It can be a deeply unsettling experience. You feel unwell, noticing symptoms that align with early HIV infection. You get tested for HIV, seeking clarity. However, the test result comes back negative. Relief turns to confusion as symptoms persist. This scenario is more common than you might think. It raises questions about your health and test reliability. The human body is complex, and symptoms can overlap. Symptoms like fever, fatigue, and sore throat prompt a search for answers. A negative test can feel like a dead end if symptoms persist. A negative HIV test is generally reliable but not always final. We need to explore reasons for this discrepancy. This essay aims to explain why symptoms persist despite a negative HIV test. We will discuss the window period and other conditions with similar symptoms. When HIV first enters the body, it begins to replicate rapidly. This initial phase is often referred to as acute HIV infection or acute retroviral syndrome, ARS. During ARS, the immune system recognizes the virus as a foreign invader and mounts a response. This is when many people, though not all, experience symptoms. These symptoms are often described as being flu-like or similar to mononucleosis. They can include fever, fatigue, rash, sore throat, swollen lymph nodes, muscle and joint aches, headaches, and sometimes nausea or diarrhea. These are general signs that your body is fighting off an infection. The symptoms of acute HIV infection typically appear within 2 to 4 weeks after exposure to the virus. They can last for a few days or several weeks. Because these symptoms are so general and can mimic many other common illnesses, they are often overlooked or misattributed to something less serious like a common cold or the flu. This is one of the reasons why HIV can sometimes be transmitted unknowingly during this early stage, as the infected person may not realize they have HIV. The viral load, which is the amount of HIV in the blood, is extremely high during acute infection, making individuals highly infectious. It is important to note that not everyone who contracts HIV will experience noticeable symptoms during the acute phase. Some individuals may have very mild symptoms, or none at all.